Gentlemen, that is the sound of the most tireless worker you will ever know, your heart. It beats around 1 lakh times a day, 25 million times a year. It pumps 2,000 gallons of blood through a network of vessels that, if laid end to end, would wrap around the earth not once but twice. It is a biological marvel, but it has a weakness, a vulnerability that claims millions of lives globally every year. We call it a heart attack. Doctors call it a myocardial infarction, but I call it the silent saboteur. Today, I want to take you on the journey inside your own chest to understand exactly what happens during these terrific moments. We are going to break down the mystery. First, imagine your heart is not as a Valentine shape but as a high performance engine. Like any engine, it needs fuel. That fuel is oxygen rich blood. Now, strangely enough, even though the heart is full of blood, it can't use the blood inside its chamber. It needs a special delivery service. These are the coronary arteries. Think of them as the fuel lines running specially into the engine block. When these lines are clear, the engine hums, life is good. But over years, decades, really, a crime scene is being staged. This is the pathophysiology. How it happens. It starts with damage to linear lining of these arteries. Maybe it's from high blood pressure slamming against the walls. Maybe it's the toxic chemicals from smoking. Maybe it's high blood sugar. Once the wall is damaged, cholesterol, especially LDL, the bad cholesterol sneaks into the wall like a squatter. The body sees these intruders and sends white blood cells to fight it. This creates a war zone of inflammation. Over time, this mixture of cholesterol, dead cell, and calcium hardens. We call this, and imagine a four-lined highway slowly being reduced to two lines due to construction debris. Traffic, blood flow can still get through, but it's tight. You might feel it's as angina or chest pain when you run on the bus. The engine is strutting because the fuel line is narrow. But a narrow pipe isn't heart attack, not yet. The heart attack happens in a split second, violent biological event. Most heart attacks occur when the plaque, that hardened debris, suddenly ruptures. It cracks open like a fissure in a sidewalk. The body panics. It thinks we are bleeding. It rushes platelets to scene to clot the wound, but because the space is already tight, the clot doesn't just seal the crack, it seals the whole artery. The crisis and ischemia. This is the moment the clock starts ticking. Downstream from the clot, the heart muscle is starving. This is called ischemia. The heart muscle are grasping for oxygen. They switch to emergency backup power, which creates lactic acid. This acid buildup triggers nerve endings, causes that crushing chest pain. The elephant sitting on the chest. But here is the scary part. The heart doesn't stop beating immediately. It keeps fighting. It tires, it tries to pump, but a section of the wall is paralyzed. The blood flow isn't restored within 20 to 40 minutes. The cells do not just starve, they die. This is necrosis. Once heart muscles dies, it doesn't grow back, it turns into a scar tissue. A scar tissue doesn't squeezes. A scar doesn't pump. A massive heart attack leaves the engine permanently underpowered.